So what you'll need for this final makeup is some latex. You'll also need a sponge to apply the latex as well, preferably something with a flat surface. You'll need some Prozaid. I wouldn't recommend substituting this for anything. I've tried Spirit Gum already and it seems to have a reaction with the latex, so definitely stick with Prozaid. And something to apply the Prozaid as well, so I generally just use these cotton tips to apply that. You'll need some cream-based makeups or lipsticks. What you're looking for specifically is something that looks like the inside of a blister, so like an irritated red color, and just for coloring at the end, either something that looks like a kind of bruised tone or something that may be slightly darker to your normal skin tone as well. You'll need to pick up some ice gel. So they sell this at most special effects stores. It's used as a sort of substitute for real ice. It holds its shape pretty well. If you can't get your hands on this, you could probably just use normal hair gel. Make sure you don't have a reaction to it either, because it will be touching your skin directly. You'll need one of these sort of, fine pointed plastic syringes, and you can generally pick these up from a pharmacy. I think dentists also use these as well, so you could probably ask your dentist for one. You'll need some eyeshadow or some sort of colouring to colour the gel with. So rather than just using it plain, I tend to go in and sort of, mix in a bit of yellow and a little bit of orange to create a sort of, a fluid colour that's similar to a real blister. And then the other thing you'll need is something kind of pointed like a needle or a toothpick. I tend to just, stick with this sort of fine needle point tool here. If you can't get your hands on one of these, you could definitely just use a regular sewing needle. Be careful, obviously, because they're sharp. A toothpick should do fine as well. So what you want to do first for this makeup is grab a bit of the ice gel and then sort of spoon out about a tablespoon maybe. If you want to, you can definitely mix up more of this and then just keep it in an airtight container. And then grab the eyeshadow palette and scrape out a little bit of the yellow and a little bit of the orange. You don't want to go too heavy with the colouring in this either. Keep some of the sort of transparency of the ice gel too. So you just want to tint it slightly, I suppose. So once you've mixed it up, it should sort of look like this. And what I normally do is I just keep a little container of it to one side of my desk. I've got different sort of shades inside there now. It doesn't matter too much that it gets mixed up. So just put that in an airtight container and keep it to the side. And then what you want to do is grab the cream coloured makeup again and grab a brush and just sort of mark out on your hand or wherever on the body, preferably somewhere flat and kind of relatively firm too is a good place to do this makeup. So what I'm doing now is just painting the inside of these blisters. So I might sort of start with a slightly larger one here and then create a few smaller ones around the outside. And once you've done that, what you want to do next is grab the Prozaid and grab a cotton bud and then just put a layer of Prozaid around the outside of those red dots that you've just drawn. So once that Prozaid has dried, you want to grab the latex and just grab the flat sponge and dip it in, and you want to cover both the Prosaid and the cream-based makeup that you've just put down in a thin, even layer. Try not to go back over the areas where the latex is already dried, because what you'll find is it'll actually start to peel back up again. So we'll just wait for that to dry. But what you want to do now is actually build up about sort of 3 to 4 layers of latex. So I've now put down 4 layers of latex on top of that and let every layer dry between. And what I want to do next now is grab the syringe and grab the little container of blister fluid that you mixed up before, and just grab a spatula, or you could use your finger as well, and fill that syringe up. And just keep that to the side now. And what you want to do to be able to inject that fluid underneath the latex, you need to create a little kind of hole to insert the tip of the needle into. And this tends to be kind of exposed. I've tried to cover it up once I've made the hole in the latex, but I find it quite tricky to do. So to sort of disguise, I suppose, where the hole is, what you want to do is just sort of grab a little bit of the latex, and be careful not to stab yourself while you do this, but just at the bottom of where the blister is. And what you'll notice is that it'll actually come up off that cream-based makeup quite easily. So I don't know if you can see that little white dot there, but that is the beginning of the latex lifting up off the top of that cream makeup you put down. What you want to do is create a little pocket of that just to be able to get the needle point into. So now that I've lifted that up, I want to make the hole sort of slightly larger, just to make sure that I can actually fit the tip of the syringe in there. So I've now gone in and just created a little hole there at the very bottom of the blister shape. And what you want to do is get the tip of the needle and kind of insert it into that hole. And then once you've got the tip in there, you can start injecting the kind of blister fluid underneath. And just fill it out to the sort of very outer edges of that kind of red area that you've put down. And what you want to do is just do that 2 more times to fill in these blisters as well. And there we go. So just dab up any of the sort of excess blister gel that you've mixed up that may have sort of seeped out the side. And this technique actually looks really awesome on someone's face as well. So if you're looking to kind of create, like a disease or something like that, this, trick works amazingly well. So just to add some additional dimension to these, what I tend to do now is just go in with the cream colored makeups again, and grab something sort of slightly darker. And what I find works best with this stage is get a brush that's sort of relatively flat like this, and small and goes out on an angle. something with, you know, quite stiff bristles seems to work the best as well. And what I normally do is just, you know, go in with the brush now and sort of fan a bit of color out from the edges of the blister. So that is the final result there. That's my diseased blistered skin using colored ice gel and latex.